Hi, I'm Melanie McGrice and I'm the dietitian at the Epworth Bariatric Centre. We'd like to just welcome you here and we look forward to working with you. Now today I was just wanting to go through a few of the common questions that I get asked about bariatric surgery and what my involvement is. First of all, just about how the band works. I know that the doctors have already explained it to you, but I'd just like to reinforce it. There's two ways that it works. Firstly, it helps to reduce your portion sizes. So it's very difficult for you to eat very large meals all in one go after having the band in place. But it also works a second way. And that second way is by keeping you feeling fuller for longer between meals. That way you don't need to eat as often. So the way that that works is that food empties more slowly through the band, and because of that you feel fuller for longer. So it's got two great advantages. Both of those things work together to help you reduce your total kilojoule intake, which means that that'll help you to lose weight over time. A lot of people ask me what type of foods they can eat after having a band put in place. Well, the answer to that is that you just want to basically have a normal healthy diet without having too many high kilojoule foods. But there's no particular foods that you have to avoid. Yes, there are some foods that are more difficult than others and take more time and patience to eat. And those foods tend to mainly be meat, rice, pasta and bread. But they're certainly not impossible, and most people with a band should be able to eat those foods. And secondly, is we really encourage you to eat those foods because they're the ones that are very healthy and nutritious for you. But what you need to do is you need to eat them more slowly and more carefully. So what foods can't you eat? Well, there's no foods that you can't eat, but we need to ensure that you don't have too many high kilojoule foods, so treat foods, and particularly high kilojoule liquids. So that's things like cheese and ice cream and chocolate that melt in the body at room temperature. You would have heard that the gastric band is a tool to help you lose weight. It's not a miracle cure. Because it's a tool, there are some guidelines that we ask you to follow, and that you need to be able to commit to these guidelines to get the best results possible out of your band. So the first thing is that you need to be able to eat slowly and chew well. So eating slowly is something that's quite uncommon in our community today, but it will really help you to get the best of results out of your band. So that's something that you can start practicing doing now, is eating as slowly as you can. You need to chew your food really well as well, particularly more fibrous foods like vegetables and salad and steak. And usually I'd recommend that you not only chew those foods well, but actually cut them up into very small portion sizes, like you would for a little toddler. Like I was saying earlier, you actually don't need to eat as regularly because food empties more slowly through the digestive system, so you actually won't be hungry as often. A lot of people tend to snack out of habit rather than out of hunger, so you need to listen to your body and decide when you don't need to eat between meals. Usually 3 meals a day is plenty for most people. Next thing is that we ask you to separate your foods from your fluids. So what that means is that we ask that you don't have anything to drink for a good 15 minutes before eating a meal and for about 45 minutes after eating a meal. This gives the food time to get down to the stomach properly without causing you any vomiting and without pushing the food through the stomach too quickly. We also ask that you take a multivitamin on a daily basis just to make sure that you're getting all the nutrition that you need, and then exercise. I know that some people can't exercise and that's why they need the surgery in the first place. And that's fine, but for most people you can, particularly once you've lost a little bit of weight. Exercise is good for so many things, but it will help you to lose more weight than somebody who can't do any exercise. So it's really important for you to be as healthy as you can be, to be doing some form of exercise on a daily basis. And finally, we ask that you come and see us regularly. Regular follow-up with your physicians, doctors and dietitians will help you get the best results possible. There's a lot of misinformation out there in the community, and some of that can be dangerous and misleading. So we ask that if you've got any questions that you come and speak to us so that we can give you the correct answers. We're also there for lots of support for you, and research shows that the people who come and work with their health professionals the most regularly are the people who get the best results out of their surgery. And we really want to help you get the best results that you can. So we recommend that you come and see myself pre-operatively, so that in your pre-operative appointment I can speak to you and do a nutrition assessment and find out what your main eating issues are, and I will also educate you about your pre-operative diet. Pre-operatively, we put everybody onto a meal replacement called OptiFast, and with that you take that 3 times a day for a week without any other food except for vegetables, and that will help to reduce your liver and then reduce your risk of complications before the surgery. So I'll explain all that to you in your pre-operative appointment. When you're in hospital, you'll be seen by one of our other dietitians, and they'll give you a meal plan to follow for the next 4 weeks after surgery. With that meal plan, what that does is that will start off with fluids for about a week and a half, and then move on to a pureed diet, and then finally onto a solid diet. We ask you to stick to that as close as possible, and if you have any questions or problems with it, please give us a call so that we can help you make the changes rather than just making them yourself. That meal plan ensures that you get all of the nutrients that you need in a very limited amount of food. And it's very important that you do stick with that progression, because you'll find that there's a lot of swelling in the stomach after your surgery, and we don't want you vomiting by eating something too solid too quickly. After surgery, I'll see you about 4 weeks after your operation, so that we can ensure that you're getting all of the nutrition that you need and that you're coping well with your diet before starting to put any fluid into the band. Then after that, I hope to work with you over the coming years on a regular basis, usually somewhere between 3 to 6 monthly appointments, to help you make dietary changes, change your habits, and get the best results out of your band. So I hope that answers your initial questions, and I really look forward to meeting you and discussing all this with you in person. Thanks.